Welcome to Practicing Multilateralism, the podcast that brings you the voices of those shaping international institutions from the inside. This podcast is brought to you by Graham's Observatory of Multilateralism and International Organizations and by the Geneva Graduate Institute's Global Governance Center.
Hello, everyone. My name is Adam Talsma. I'm a PhD candidate at IHUID at the Geneva Graduate Institute, studying innovation in international organizations, or IOs, as I might use in this episode. And I'm an affiliate at the Global Governance Center and the Global Health Center, both here at the Institute. And I am pleased to be hosting this first podcast of Practicing Multilateralism. Thank you for joining us. Today, I'm very happy to have Louise Agersnap joining us. Louise is a political scientist, and as well as the head of the WHO Innovation Hub. And Louise and I have also worked together in the past at WHO as colleagues and collaborators. So today, really wanted to just have a chance to really hear from you, Louise, and also share some of my own experiences as well, just having a conversation. We'd like to cover, maybe we'll start with things more around our personal journeys and what that looks like, but then move on to looking at WHO's role in innovation ecosystems. And this is really what the topic of this first podcast is about, is looking at the global health innovation ecosystem, what that means in practice. And a deep dive into WHO as an organization. That's a key player in that. Of course, there's been some disruptions in the space, so we'll also touch on this, and also really looking forward to getting your perspectives on what may lie ahead and discussing the future. So welcome, Louise, and thank you for joining us. Let's start with where you are now. What does your day-to-day look like as the head of the WHO Innovation Hub, and what are you and your team trying to accomplish?
Thank you, Adam, and it's great to be here. Thanks for the invitation. So WHO is obviously in innovation. We don't build gadgets. We are a normative standard-setting agency. We're a technical agency, and that brings with it a lot of trust in what we do. What we do is science-based, evidence-based, and we put out guidance and standards for governments, and in particular their ministries of health, to follow. So now in the space of innovation, that gives also a strong opportunity to help shape the innovation ecosystems of the world at the global, regional, country levels. And I think it's also important to remember that when you set standards that governments follow, you actually also help build trust in other stakeholders beyond governments, meaning private sector, entrepreneurs, investors, etc. So that is also what helps shape markets. And as we know it in innovation, there's also a lot of technology, and the private sector is very active there. So we also want to use that to build a bridge to the private sector to make sure that there are productive relationships between public and private sector. So as we strengthen ecosystems and really with the focus on scaling innovations, democratizing access to technology and innovation in countries where that access doesn't exist, I try to bring an entrepreneurial and sort of startup mindset to this. And that means that we also are open to testing and learning and partnering beyond our own organization, our own type of organization, really partnering with the unlike and unlikely partners, because with that diversity also comes impact. Very concretely, we've, over the past year, been working on finalizing a WHO guidance and toolkit, and you know very much how we did that because you were very involved, for how to scale innovation in public health systems. And with that, we can also, I think what's been interesting in that regard, and you know that as well, is that scaling innovation is actually not so much about the thing you're trying to scale, but much more about the things around it, the leadership, the institutions, how they enable or not the scaling of an innovation the regulation around it, incentives that are created in other stakeholders, and the capacities of that system. So you will see that when this guidance comes out later in the year, that hopefully that will help governments feel more comfortable and confident as they take on that stewardship role. Part of the work that we're doing is also very much about creating a shift away from what we call supply-driven innovation, where people and organizations and companies are pushing out innovation, and they don't understand why they don't stick and why they don't scale. So what we want to do is, and what we are doing is, to promote a demand-led notion of innovation. And that means really starting with what is it that countries and their populations need, the social good that is needed, and then work from there. And very concretely, we are working with 17 governments across Africa in the Demand Catalyst program, supported by Grand Challenges Canada, a pioneer in this space. We're supporting the scale-up of innovations like Friendship Bench, a community health, mental health innovation in Zimbabwe, solar-powered oxygen concentrators in Somalia, and many other innovations. We have also this year, we're running a global innovation challenge called LEAD, where we this year are focusing on artificial intelligence, and we've sourced 76 strong ideas using AI in health programs across the world. And really fascinating ideas are coming up, like an AI companion for frontline health workers in remote clinics, or AI social listening tools for immunization to counter misinformation and rebuild trust. And lastly, the latest baby in the family here is the Digital Innovation Investment Platform, which is a new multilateral platform, I would say. It's a platform that essentially creates a new space for policymakers and investors and tech innovators to come together to look at how we create and democratize access to those innovations.
That's fascinating. Thank you, Louise, for all this in-depth kind of insights into the work that you and your team are doing. So I'm curious, if we go take a little bit of a step back and consider, how did you end up in this role? And I know that your path has taken its own kind of interesting routes, right? From the Danish governments to UN postings in different parts of the world. What thread connects these different experiences for you?
I guess the drive to try to make a difference and to connect people. It's a lot of my work has been as a bridge builder between different sectors, different departments, programs within the UN, but also sectors outside the United Nations. And my journey has definitely not been a straight line. I think careers rarely are. It's a myth that you can climb the ladder. I think it's really sensing your way through, and also feeling in your gut what is it that you want to do this time, and also then being open to new opportunities, and sometimes disrupting your own path and moving to a new place and seeing what happens there. So I had my my early days in Denmark after graduating, and worked for the Danish government and helping promoting international security, especially around advanced technologies, making sure they don't fall in the wrong hands. And also had a stint at management consultancy. And then eventually we moved to New York, and I would say the rest is history. We spent 7 years in New York, and in the beginning it was hard, but it was also fun. But it was hard. It took some stamina. It took knocking doors, being open to trying something new. I was freelancing and I was volunteering for the Red Cross and for the Danish Embassy in Washington, and eventually landed my own job and worked in humanitarian affairs, conflict prevention, and peace building, and often in a cross-cutting role, where my role was to bind the mandates together, find common ground among very diverse programs and sectors, etc. So throughout this bridge building role has been a theme, I think. But also using my creativity and the fact that I'm also an artist on the side, and not using that sort of as a as a thing on the side, but really something that's integral to how I work. But we can come back to that later. But I've always been driven by doing work that tangibly can improve people's lives. And I'm really, I think grateful and privileged to have been able to do that through my work with the UN and WHO. And eventually we moved to Panama. I got a promotion. We moved to Panama, and I worked there for the entire UN system across the whole Caribbean and Latin American region in sustainable development writ large, from energy to gender to uh, environmental issues in the region. That was really fascinating and a beautiful place to live. And then we went to Geneva. We were missing Europe. We wanted to come back to our European roots, and moved to Geneva. And almost by chance, I would say, I got a job in WHO, which was a great fit, I would say. But I hadn't actually thought about working for WHO when I came. But it was a great place, and I worked on non-communicable diseases and creating the global coordination mechanism, which is a platform for engaging non-state actors, including private sector, in solving the challenge of chronic diseases and their risk factors. And so again, there was a huge bridge building component to that platform. I was also part of WHO's transformation team and helped build our values charter as a global lead on culture. And then 5 years ago, I got the opportunity to start up WHO's innovation hub right at the onset of the pandemic. So really challenging times again, but it's been a fantastic journey, and I'm proud of the global programs that we have running now.
Thank you so much, Louise, for this very extensive background and journey that you've shared with us. So I'm curious. You mentioned in particular bridge building, all right? And in practice, what does it actually take to make that kind of work happen inside an organization like WHO? And what are the real barriers you faced in your current or past roles in the day-to-day?
Clearly, innovation is we represent the new, the different, the change, etc. And organizations and people are not always ready for innovation. And people like their comfort zones and business as usual. And change seems risky. Innovation seems risky. But the truth is that status quo is extremely risky. And I don't think people realize that enough. There is such a comfort in doing the things we know how to do, even if we know that it's not hitting the mark. We're not going to achieve all the sustainable development goals by 2030. We're lagging behind. Too many people are in ill health and facing struggles, and too many people are dying from preventable causes, and that's a shame. That's a real tragedy, and it's something we can do something about. And innovation is something we need to look into, and we need to use it. And there are so many innovations that are proven, evidence-based, and they show impact. Why don't we start there? But so there are days, Adam, where it's like pushing a boulder up the hill. I'll be very honest, and where you either get lack of engagement, or simply a no. So that lack of support is sometimes tough. But what keeps me going is, first of all, that there are lots of people who get it and who are excited and see the impact and believe in it and know the urgency of embracing innovation. And there's also the whole issue of the next generations, right? We're also doing it for them. If I don't break some barriers, who's going to do it for my son and my daughter? So I believe in this work, and And I'm excited about the groundswell we're feeling at the moment. And of course, in times of crisis, there is a knee-jerk reaction to go back to basics and, okay, let's just focus on the core. But it's actually the opposite we need to do. We need to rethink. We need to use innovation. We need to embrace the new technologies and create access for them and democratize that access. And I would, I would say also, maybe as a woman working in this international space over the years, I've learned that competence doesn't shield you from the occasional unconscious bias and mansplaining, etc. But that's unfortunately the reality. But there are ways of pushing through and still doing what you need to do.
And we'll come back to some of this on, I think, this situation now, and also some of this entrepreneurial kind of aspect within the organization that you are pushing for. I guess I'd love to hear, though, first a little bit more about your background as an artist, and in particular, I'm curious, how does that shape your work, and or how has it shaped your work or contributed to what you've been able to do?
Yeah, as I said earlier, I mean, I bring this art with me. It's a creativity that I think we all possess. And it's not just by, art as the paintings I produce, but it's also the creativity that I use in my work. You may see patterns it may help you reframe situations or ways of seeing things. I think art and creativity is very much about new perspectives and seeing things from a different angle, and not least being comfortable with ambiguity and navigating in that. I think that's also vital for systems innovations, and I think it's what I've been drawing on as I have, conceptualized new things like this digital innovation investment platform.
Very interesting. And actually, maybe one thing that I remember too from working together, I thought was interesting. I think there's a LinkedIn post on that people can see this, was you had mentioned the idea, or had the idea of SDG 18, creativity, right? And I thought that's a very interesting idea of how, the importance of creativity and actually development in sustainability and in our ability to sort of really operate as humans in this world. So I'd love to zoom out a bit now and really talk more about the global health innovation ecosystem and what do we mean by that. It's this complex web of actors, governments, but also startups, universities, companies, manufacturers, investors, nonprofits, community organizations, and then you also have organizations like a WHO in there, and really all are involved in a dynamic process of not just coming up with new ideas, but making them, incubating them, translating them into use value. And each plays different roles in this space. And how do you see WHO fitting into this landscape?
Well, I think WHO has a very unique role in this space. It is the only global standard-setting normative agency. And as I said earlier, this brings with it trust, and it's a strong market-shaping, behavior-shaping ability. And so that's what I think we can bring to the table, as well as our convening power. Because with trust, you can convene better, and you are also a neutral broker in that space. Obviously, we all, across the global health and development multilateral system, have unique roles, and we need everyone. But WHO has a unique role, which we're leveraging in the space of innovation. And I think Geneva is a fantastic ecosystem for global health as well, where we've also been convening people in our Eureka Innovation Lab at our headquarters, making sure that we have those conversations with the other important players in this space and learn from them.
So let's talk about the elephant in the room. The past few years have seen significant challenges to multilateralism, and actually WHO specifically, interestingly enough, right? There's been funding disruptions, but those aren't things that are necessarily new, right? There have been big major cuts in the past. But what is a little bit different about this is one of the key architects, the US, of the multilateral system, really pushing against it, or potentially trying to, in some cases, not just underfund it, but undermine it politically. And there's been intense scrutiny from COVID-19, and WHO's role was very prominent in that. From where you sit, what has this meant for your work day to day, and how has it affected WHO's capacity to play this innovation stewardship role?
Yeah, I mean, these are indeed dire times for a lot of people and a lot of organizations, and in particular for people who used to who are depending on our work. Um, so yes, it's affecting us deeply. Um, But if we zoom out a little bit, I think, we've been saying for a long time that we are in a polycrisis with very sort of interlocked, complex issues of climate change, pandemics, conflict, antimicrobial resistance, economic fragility, etc. But some, and I would also argue that we're facing a metacrisis. And this means that our whole operating system is put in question now. It's outdated. It's built on short-termism and also an extractive relationship with nature, as well as relationships between countries based on economic models that are part of the problem and that are also affecting the sort of inbuilt hierarchy among countries. So a lot of that is actually not very good. It's not something that we should be, maintaining or protecting. And some of it, yes, we see the cracks opening. But sometimes when you are in that kind of change, it's the opportunity for something new to emerge. So there is huge opportunity in the uncertainty we're facing right now, although it feels very uncomfortable. And of course, I would say it's happening very fast, and that speed is extremely disruptive and also painful and harmful. So I'm not, in favor of that, but it is what we're facing right now, and I think we also need to look at what can we then use this moment to, in terms of embracing new ways of relating to one another, new ways of relating to nature, new ways of understanding the role of multilateralism, because I believe very much in multilateralism, otherwise I wouldn't be here. But I also appreciate that the notion of multilateralism is changing. I think it's becoming more diverse. It's beyond countries. It's countries and their communities. It's countries and the private sector. It's countries and the resources they have, etc. So I think we have an opportunity to see multilateralism in a more diverse way.
And this is interesting. You sort of frame this metacrisis in this kind of way, and I think from an innovation studies perspective, some have said there's sort of a difference between how you would handle a crisis that you're given. There's sort of the more entrepreneurial kind of stance, which really tries to see this as an opportunity. But then you also have the more trustee-like stance, which sees a little bit more like an administrator and how do we conserve existing resources, right? And I think that, this is where you were talking earlier about the entrepreneurial spirit that you're encouraging within WHO, and I think it's interesting because it's intrapreneurship, right? You have people within this organization, this bureaucracy or large organization that are looking for to do things differently in the world, but also navigating their own organization and knowing how to hack the organization, to make it happen, which isn't always so easy. And I'm curious if you could maybe give us an example of an opportunity that you've seen emerge, because there is a critical juncture here potentially where some new opportunities are emerging. And if there's something that in practice you've seen in WHO that people have tried to set up to do that takes advantage of this opportunity.
Yeah, absolutely. I think the WHO digital innovation investment platform that we've created over the past half year, and which we launched at the World Economic Forum in Davos in January, is having huge momentum, and it speaks exactly to that new kind of multilateralism, because it is a platform for engaging policymakers and decision makers from both public and private sector, the investor communities, the communities of patients or people, if you will, and the entrepreneurs in countries, the innovators, and then looking at, us as an ecosystem. What is it that we can do in terms of making sure that technologies will get to benefit people who need them? And this is of course, very complex task. Everything we're facing is complex today. It's not complicated problems, it's complex. But that's also what I love doing and what fascinates me. And we need to cross many hurdles together. And we're talking about in the economic realms, the investment models for, say, we're looking right now at robotics and telesurgery technologies and how that can be an impactful model, and already showing evidence to that effect of enabling surgeons to telementor other surgeons in other countries, so they don't have to travel to go there and deliver that training in person, but they can do it, a 2-hour break in their hospital somewhere, and just log on and be part of, even assist in an operation. It's really fascinating, and it's not science fiction. It's actually happening. And these are also types of technologies that are much less invasive, meaning there's less infection risk, there is quicker recovery, etc., etc. And the savings from in human costs, but also in hospital and health system cost, are significant. But we want to build that evidence. We want to work with countries who are already doing this. Countries like Angola, Panama, and others are interested in this field. And we want to work with them to build the evidence from real case studies. We want to have conversations with the other players in this field and enable those dialogues to happen. And based on the evidence, we will build guidance and set standards so that governments are more informed as they venture into this field. And this is what will eventually also build confidence in a market and shape a market. And all of that is necessary if you want to democratize access to technology. So I would just say, beyond the economic challenges, is of course also the ethical issues that need to be tackled, as well as infrastructure, the interoperability, the reliability, etc.
Thank you, Louise, so much for giving us this perspective today, really, into WHO and the global health innovation ecosystem. Fascinating. As we bring this to a close, I'm curious, especially for students listening, or those who are earlier in their career, who are interested in working in multilateral organizations or studying and researching global governance. What's your message to them? What do they need to know about what this work actually entails?
Yeah, I think I would say that I understand if the current moment seems very frightening, and it's really hard to see where to go. But I think if you take the big picture of history, things have been changing all the time, and sometimes for very necessary reasons, and with all kinds of outcomes. But it is the opportunity that you have in the moment of actually that uncertainty holds a lot of opportunity. And so I would say, be part of it. Be part of it, but be open to not knowing it all and accept that you don't know it all, and use that as your cue for reaching out to others who might have answers, or together you can find answers. And that also entails working with completely other disciplines than your own. Don't lock yourself into your own bubble, but work with others, make it creative, make it diverse, and you'll surely have a lot of fun with that. And hopefully and very likely you will create something better. So think beyond just making money. Try to do something that's good for other people and for the earth.
Well, Louise, thank you so much for this conversation. It's been revealing to hear not just about the vision and what you wants to do in WHO, but also the practical realities of making innovation work in a complex organization like the World Health Organization. So thank you very much.
Thank you, Adam.